arms towards the sun. You feel the warmth of the rays, and then you know you're alive, and you don't have to be afraid of anything, 'cause you know the truth, and the truth is love, yes it is. Wasn't what they said to you, or anything that you learn from a book or from the news. It's not like that, 'cause it's a thing. It is something that you do. Doop 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 a doo. Doop 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 a doo.
Welcome to the Bassline, everyone. Dr. Michael Palmer is a medical doctor, a biochemist, and a microbiologist. He lost his job for refusing dangerous mRNA injections. More qualified and knowledgeable by far than the average refuser, he has written a book about mRNA toxicity. His book, mRNA Vaccine Toxicity, is available for free online as a public service and has already been translated into several languages. I encourage you to download it today. It is with great excitement that I welcome to the Bassline the learned Dr. Michael Palmer. Welcome to the Bassline, Dr. Palmer. How are you today?
Oh, I'm fine. Thank you very much, Jeremiah, for the invitation.
Oh, well, thank you so much for accepting the invitation. I'm really thrilled to have you here on this wonderful Friday afternoon. Before we get into our exciting and invigorating discussion, I want to ask everyone, of course, please support this show. This is a listener-sponsored endeavor. I'm a citizen journalist at your disposal, but your support is more than heartfelt at this point. It's really keeping the wagon wheel rolling, so to speak. That means you can support by going to jeremiahhosea.com and buying a song. You can subscribe to my Substack. If you're a paid subscriber, that's wonderful. If you can't afford to subscribe at the moment, please subscribe for free right away, and subscribe when you can afford it later. And you can also get a chess lesson. You could get a bass lesson. I'm an educator. Reach me through jeremiahhosea.com, or for that matter, remotelearningchess.com. And there's many ways you can support the program. If you really don't want a chess lesson, and you really just don't want to go through any kind of rigmarole, well, I guess I'd take a direct donation to Venmo or PayPal or whatever, but I'd rather work for the money, so to speak. So please support this program in any means that, by any means that you find possible. Also, we're going to have a great Twitter space tonight. I'm going to be discussing various matters of left and right, of medical freedom. The title, I guess, is officially The Illusory Left-Right Divide and Hybrid Warfare, with our guest this evening, Brooke Hines, who has an awesome Substack. So we want to kind of bring Brooke Hines into the family. She's written some really great stuff, and I want to introduce her to my little Twitter gang. We're sort of like the Little Rascals or something of medical freedom fighters. But all that being said, I also want to quickly apologize. I'm sorry last week if I sounded a little bit distracted in the first 10 minutes of the show as we were trying to get Dr. Rima Lebeau on the line. But, well, I was distracted because I'm like trying to sort of tap dance and produce content, so to speak, while I'm texting and saying, hey, can we get Dr. Lebeau on the line? But no worries about any of that. It was an outstanding discussion with her, and, you know, it just took a minute for us to get dialed in there, and then we were off to the races. So all that being said, we have the brilliant and insightful Dr. Michael Palmer as a guest today. As I mentioned in the introduction, he wrote a book called mRNA Vaccine Toxicity, and I'm very fascinated by this subject. I have several questions lined up for Dr. Palmer, and the first question I want to get into, because I'm sort of testing my knowledge as a layperson here, am I correct in saying that the people who pushed these shots knew mucosal immunity could not be achieved by injecting something into someone's arm muscle? And I'll just say before you answer, Dr. Palmer, I guess one retort that comes to my own layperson's mind is, well, what about flu shots? But flu shots don't confer immunity, right? They're supposed to be a window of protection. I mean, not to make you give us a technical explanation of what a flu shot is, but basically, no one's come up with a cure for the cold or the flu. We never said, hey, we can inject this into you and you're not going to get colds anymore, right? It's a part of life. So were these folks just kind of being con artists effectively when they said, hey, we're going to inject something into your arm and you will achieve mucosal immunity through this? Did they claim that they had invented something that they knew darn well they hadn't invented?
I think, yes, I think that's true. At least the experts, for example, Fauci and the other people at the CDC or wherever else in the health administration, they should have known it. It's not new, I mean, I was digging around the vaccine-related literature a little bit, as you can imagine, and I came upon a review from the year 1992. And there, the author already expresses bemusement that people persevere using intramuscular injections when it's already very well established at that time that it won't work, that these injections will be essentially ineffective when it comes to providing mucosal immunity. Okay. Now, this does not necessarily mean that these injections must, by definition, be useless, because in many cases, I mean, the infection establishes itself initially on the mucous membranes. So this is where the virus initially replicates, and then with some more severe diseases, the virus may then spread from this primary location to other places, other organs in the body. And antibodies that circulate in the bloodstream, they will not be able to prevent the mucosal infection, but they may intercept the spread to other sites in the body. And the best example of that would be poliomyelitis, right? It is also a virus that initially replicates in the mucosal membranes, in that case in the intestinal tract. And then in some patients it spreads from there through the bloodstream to the central nervous system, and then it produces the damage to the nervous system that results in the characteristic symptoms of poliomyelitis. And a vaccination, for example, with the Salk vaccine, right, the traditional inactivated virus vaccine, will indeed induce the formation of antibodies in the bloodstream, and they will intercept the virus at that stage. So the Salk vaccine will do very little against the likelihood of an infection of the mucous membranes, but that infection is also not very serious, in the case of poliomyelitis at least. And so therefore the more severe consequences of the infection, which would pertain to the central nervous system, those are indeed intercepted by the intramuscular injection. Now, it still is a different story with the COVID vaccines, because the COVID vaccines were pushed on everybody with the argument that we need to protect grandma and so on and so forth, right?
Right.
So it was always vaccinated in order to no longer be able to spread the disease. And that is a fallacy, because the spread would simply result from the multiplication of the virus on the mucous membranes, right? Regardless of whether or not the virus gets into your system and spreads to other organs. From there, from those other organs, it cannot spread to anybody else. Virus particles that can spread are the ones that are formed on the mucous membranes. So therefore, in order to suppress transmission, you would actually have to achieve mucosal immunity. And that is precisely what these vaccines were never proven to do, as is acknowledged in the FDA assessment reports on both the Moderna and on the Pfizer vaccine. Right? It says there explicitly that prevention of transmission has not been proven, and indeed these so-called clinical trials, they didn't even make any provisions. They didn't even try to establish whether or not transmission was inhibited. So you have it right there. These vaccines don't do, they cannot fulfill the purpose that they were advertised for, right? Which the reasons for which they were forced on everybody, the alleged reasons, right? The vaccines could never live up to those promises. And this had to be expected from the outset. And I guess this is the reason why it wasn't even attempted in the clinical trials to prove that transmission was inhibited, because if it had been tried to establish that, the result would have been negative. They would have simply documented that the vaccines do not stop transmission. So they prefer to not even try to look into this question.
Right. Right. This is very troubling. I guess you can see I sort of have a penchant here in my questions. I am prejudiced in my own way. Like the historian Howard Zinn said, you can't be neutral on a moving train. So I'm not really going to pretend that I'm per se neutral here. I do believe there was a criminal component to what happened. So I guess in a courtroom, what I'm about to do is called leading the witness, if that's the correct term. But sort of along the same lines in terms of, yes, my question does contain the presumption of some sort of corruption here. But again, layperson trying to understand, am I correct in saying that the dangers of mRNA, as well as the dangers of the lipid nanoparticle, were well documented, and nothing was invented or discovered that would justify the claim that the safety issues pertaining to those two items I just mentioned were resolved? Is that correct? Did they go ahead and push a dangerous technology, two dangerous technologies rolled into one on the public, and just say, hey, let's just take our chances with this?
Well, what makes these mRNA vaccines so particularly poisonous is the combination of those two technologies. So the lipid nanoparticles as such, they have toxic potential as well. And one has to note here also that the particular lipid molecules, the particular lipid compounds that were used by Pfizer and by Moderna were never even tested on humans before. Okay, so they were not tested on humans. They were not even available in pharmaceutical purity. So if you look into these assessment reports again, you will actually find that the FDA, and after the FDA also the European Medicines Agency, they complained about the lack of proof from both Pfizer and Moderna that these compounds were even pure. So these compounds contained some impurities, and these impurities were not known as to the composition and as to the quantity. So what FDA and EMA actually did, they said, you have to give us proof later, but for now we already approve your drugs here, your vaccines here. So this was also unprecedented, I mean, it's totally crazy. They approved untested compounds that contained unknown amounts of unknown contaminations. They approved this simply as drugs. I mean, it is totally crazy. It was also unnecessary because there is one drug on the market, which is called patisiran. It's used to treat some rare metabolic disease, mostly affecting the elderly, and this also contains some lipid nanoparticles, and those lipids have undergone some considerably more extensive testing on humans already. So it's a little bit of a mystery why Pfizer and Moderna didn't just opt to reuse those already approved lipids.
That's a fascinating detail.
So that's one thing. But on the other hand, with this patisiran, I mean, the amount of lipids that get applied to you and to your system is much, much larger than it is with the vaccines. And we also have to note that the severe side effects that we have seen with the mRNA vaccines are quite similar to those which we also see with the adenovirus-based vaccines from Johnson & Johnson and from AstraZeneca. Now, what these two different types of gene-based vaccines have in common is that they induce our body cells to produce the spike protein. In each case, they sneak a genetic copy or a genetic blueprint into our body cells, In the case of the mRNA vaccines, it's directly the mRNA which can immediately bind to the cell's ribosomes, which are the cell's little protein factories, so the cells can immediately start to churn out spike protein. With the adenovirus vaccines, there's one step in between. So in this case, we have a DNA copy that gets transferred into the cells. This has to first be copied into mRNA and then again into protein, transferred it into protein. But the end result is the same. Our body cells make this foreign protein, this spike protein, okay? And the key damage mechanism is that the immune system recognizes this foreign protein, this viral protein, in and on the surface of our body cells. And it then leads to the conclusion that these cells must be infected by a virus, and it goes about destroying these cells. Okay, this is what the immune system always does. If it flags a cell as infected by a virus, it will destroy that cell. That sounds pretty drastic, but then you have to consider that that a virus that infects a cell tends to turn this cell into a virus factory. So this cell will simply be taken over. It's a hostile takeover, if you will, and the cell will simply start churning out more virus particles. So it's a lost cause at that point, and the best the immune system can do to deal with it is simply kill it off. So this is what really happens, right? And this was actually predictable that this would happen. And some people who advocate for these vaccines, they will tell you, yes, that's true, but this is the same thing that also happens with regular viruses and with live virus vaccines. Okay? Now, there are several points why this is not true. It's superficially true, right? In both cases, there will be some cells that will be sacrificed, but there are some key differences here, right? One is, and this is something that few people even talk about, the simple fact that particularly with the mRNA vaccines, the particles, the lipid nanoparticles, they do not contain any copies of the viral proteins, right? If you have a real virus particle, it contains a nucleic acid in the middle, and this is enveloped by several different viral proteins, okay? Now, what happens if this virus infects a human who has not been exposed before? There will be no immunity, so this virus will make its way into the body cells, and these body cells will then produce viral particles, and the immune system will then produce antibodies against those viral particles. And once you have enough of these antibodies will simply bind to all viral particles that float about and prevent them from entering any more body cells. Okay, so the more antibodies you have, the less of a chance the virus will have to get into your body cells, so therefore the antibodies protect you. Now, if you replace these viral particles by lipid nanoparticles with a viral mRNA inside, then these will be taken up into your body cells, and the body cells will again start churning out the copies of this viral protein, and we will again form antibodies. However, and that's crucial, the antibodies cannot recognize these mRNA particles. So no matter what kind of a level of antibodies you already have, these antibodies will not be able to prevent these LNP particles from entering your body cells. So what does that mean? What do the antibodies do? They will only recognize the viral protein when it appears again on the surface of your body cells. So the more antibodies you have, the more angry the reaction of the immune system will be against those body cells. So in a nutshell, with a regular virus, pre-existing antibodies, pre-existing immunity will prevent disease or will subdue disease. With mRNA vaccines, pre-existing immunity will make matters worse. The more immunity you already have, the more you are at risk of severe damage after vaccination. And this is exactly what we see in the databases such as VAERS, for example, right? This vaccine adverse events reporting system. We see very clearly that, for example, myocarditis is more common and more severe after the second injection than after the first. Okay? With a virus, it doesn't happen. If you have immunity, that simply means the virus won't infect you again, at least not to any significant degree. You won't get sick again. That's a typical outcome. So this simple difference, the omission of the viral proteins from the envelope of the particles that carry the nucleic acid, this is fatal. This is just one fatal flaw of the entire technology. And another fatal flaw is, right, that the dose, the number of particles that you get injected with is very high with these mRNA vaccines. Why is that the case? Because they cannot multiply inside your body. At least the ones that have been used so far cannot multiply inside your body. So you have to give in a single shot enough of these nucleic acid copies to get this forceful, strong expression, synthesis of this viral protein, and therefore a strong immune reaction against that. With the natural virus, also with a live virus vaccine, you actually inject a very small amount of virus particles. And then this virus initially simply needs to multiply a couple of rounds until it has reached such a high level that, and also the immune system has woken up and taken notice and so on, so that it will actually come to a showdown between the immune system and this virus. And the faster the immune system responds, the earlier the viral multiplication will be stopped, right? So again, the more immunity you have, the faster your immune system responds, the lower the maximal level will be that the virus reaches in its multiplication before this multiplication gets simply snuffed out by the immune system. So there never is a heads-on collision between a very high viral load and a very strong immune reaction. At least that's by and large the case. There are certainly exceptions. Obviously, there are severe viral diseases, right? And in those cases, you do have, for various reasons, which we don't need to go into now, but for different reasons, there can be scenarios in which you have a strong viral infection and at the same time a strong immune response to it. And then you are in deep trouble, as some of the patients are who have received these COVID vaccines and suffered badly afterwards, right? And one more point, I know I'm talking for quite a while already, but one more point, these vaccines, mRNA vaccines, also the adenovirus vaccines, they can infect cells in the blood vessels. Okay? Most viruses don't do that. Some viruses do, and those tend to cause so-called hemorrhagic fevers, such as, for example, dengue fever, right, or Marburg virus and this sort of thing, you know. They are dangerous viruses. And likewise, these mRNA vaccines, they infect the cells of the blood vessels, and they are also dangerous. Why is that? Because destroying the innermost layer of the blood vessels, the so-called endothelium, will expose the deeper tissue layers of these blood vessels, and the contact between those and the blood plasma will cause blood clotting. Right? And this is the explanation as to why strokes, heart attacks, and so on, venous sinus thrombosis in the brain, and so on, why these things are all observed after application of these gene-based vaccines. So there's a certain similarity there between those vaccines and the hemorrhagic fevers. And all of this, I mean, you could really, you could expect it. If you are an expert, if you have the appropriate background in medicine, it's not a particularly hard problem to figure out. All you have to do is simply step through the motions, what happens first, second, third, and then you arrive at the predictable result that has, in the meantime, been quite thoroughly corroborated and confirmed by pathological evidence.
Right. Very detailed answer there, and I appreciate that. Now, this takes me to a question that it occurred to me, I don't know, a month or so ago, and I intend on asking as many doctors as possible this particular question in one form or another, which is, philosophically speaking, ethically speaking, what can be said about a system of medicine that subjects the medical recipient to an intervention whereby they are exposed to a wide range of side effects, including the ailment they are attempting to prevent itself and death, in an attempt to prevent that one particular ailment, which again is also a side effect? Like, how did we get to that state of affairs in medicine that we're gambling with people's health, is what it feels like?
Yeah, I mean,
I'll just say quickly, I'm sorry to interrupt, but I just want to say, in terms of my communication with the vaccine injured, which is on a regular basis at this point, and we've had on this very show, we had a woman known as the coerced nurse, Danielle Baker. We're going to have other vaccine injured individuals as guests on forthcoming shows.
Yeah.
Some of these folks are suffering in such a way that I would say, you know what, I'll take my chances with COVID if that's a side effect of this medicine that you're offering.
Of course, you're right to take your chances. I mean, this was never an honest attempt to keep people safe or protect them from severe illness. I mean, it was never a sound approach in that way. It was from the very beginning. I think it was a criminal enterprise, and one might wonder why the medical community goes along with it. I guess, I mean, very few people in the medical community who still advocate the vaccines and who still dispense the vaccines would agree with your description of the situation. I think your description is accurate, but then I never was tempted to dispense those vaccines or even receive those vaccines. So I think there are three categories. I think we have people who are deliberately lying, right? I mean, Fauci, but then also many people who simply probably do know better but still go along with it because they in some form or shape personally benefit, and be it only financially. Then we have those people who are still honestly deceived because they still didn't do their homework, I guess, and they still trust the mainstream narrative, and frankly, they probably also are not particularly sharp. I mean, if you, no, it's honestly.
Sorry to laugh.
I have to call it out. If at this point in history you still don't understand what's going on, then you don't have a very active mind. And
I tend to agree with you. I tend to agree with you, Dr. Palmer. You know.
And I think then there's a third category who sort of senses that something is wrong, but doesn't dare to look into it in detail. They simply don't dare to confront the truth, the ugly truth. And so I think they stick to the narrative, I think, out of anguish because they simply cannot face the implications. They cannot face the moral, the ethical implications of what has been going on. And so therefore they simply they prefer to avert their eyes. That's what I think. These are the three broad categories. And I mean, the fraud on the medical community, on everybody but including the medical community, has been facilitated obviously by very tight control of the message, both in the mainstream media, but excuse me, but also in the medical press, right? New England Journal of Medicine, for example, Lancet. I mean, they publish fraudulent papers, right? It's clear they publish fraudulent science. I mean, this is
pretty astonishing. Would you say that that's something that kind of came about in a new way under the COVID regime, or is that something that had been going on and COVID sort of, shined a light on it?
Yeah. Yes, it has been going on for longer.
But did it worsen with COVID?
I think it got worse with COVID. I mean, the censorship got worse. I mean, those few papers that present some evidence that has implications negative to the agenda, they always genuflect before the official narrative, right?
It's very
so
strange.
It's always the usual shit sandwich, right? So at the outset they say, so it's the COVID vaccines are great. That's the one side of the sandwich. Then comes the the shit part in the middle, and at the end they again genuflect and say, okay, these are all minor problems, and overall we need to continue vaccinating because overall the benefit outweighs the risks, right? Even if that has never been really proven. So then you have rejections, right? Many critical papers that were initially published, or one or two handful of papers I'm aware of. They were initially published, but then they were retracted for no convincing reason, right? Simply because they don't fit the narrative. And I mean, I'm not sure how many people how many papers get rejected at a stage that you never hear of, right? I mean, they get submitted to some editor, and the editor sends them right back, sends them out to review, and then the reviewers shoot it down. So the censorship is certainly very great, and it has gotten worse with COVID, but you are right. I think it's not a novelty. I think that there has been a fairly strong sway of the pharmaceutical industry, right, over the content of those.
Unbelievable, their influence. It's almost like they were lurking and creeping behind the scenes for all these years.
But at the same time, right, I mean, pharmaceutical industry and its greed, I mean, they have been with us for a long time. And still, I think what we have seen in the COVID era, I think, was unprecedented, right? And also, I mean, what's also unprecedented is the total lack of due diligence on part of the FDA
captured
and
agency.
of corrective action, right? I mean, it's the side effects, they started piling up immediately, right? As soon as the vaccines got rolled out, there were reports of severe adverse events. You were maybe aware of this pharmacovigilance report that Pfizer submitted to the FDA already. It included the data up to February 28, 2021, so the first 2 months of vaccination. And Pfizer even said that at the time they hadn't gotten around to reviewing all submitted reports quite yet that were applicable to that period. And even so, some were still missing, apparently. At the time, Pfizer had received 1,223 reports of deadly outcomes after vaccination, after 2 months.
Yeah.
And the FDA just simply said, okay, fine, carry on.
Yeah, it's really scary.
Yes,
it's a 5-alarm fire.
Right.
It's basically the fire department ignoring what you call a 5-alarm fire.
Exactly. So it's really something new, right? I mean, the total capture of all the regulators. And another point is, I mean, do you see any corrective action from the courts of law? I don't.
Right, which also then lends itself to the argument that this was corrupt, right? Because then if you make a mistake, then you at least have the opportunity to turn around, we made a mistake, but there's no effort whatsoever to correct mistakes.
And I mean,
it's just full speed ahead.
Sorry.
No, I was just saying, just full speed ahead. Just keep charging in the same direction, with irrespective of all this information.
Exactly. It has been going on for years now, for years, and there's no end in sight, apparently. And it's the same everywhere, right? I mean, obviously there's, for example, Health Canada approved the vaccines just a few days after the FDA did, and they have not been able to retrieve any substantial document that would detail any kind of review process that took place at Health Canada. Apparently nothing happened at all. So they just simply followed the marching orders that the FDA put in place. And another point, Switzerland. I'm not sure whether you know or you have heard of Attorney Philipp Kruse, who is a very stalwart Swiss lawyer. And he has spent an enormous amount of worked with his team to put together a detailed documentation and a detailed lawsuit against Swissmedic, that is the Swiss equivalent of the FDA. They submitted their lawsuit already in summer 2022.
Wow.
And the prosecutors have not touched it. There's absolutely no action. It's an astonishingly detailed, astonishingly well-researched lawsuit. I've never seen anything of comparable quality from any other lawyer. And I think this prosecutor knows that they don't have a chance or that this case cannot be defended. I mean, this is just all totally clear, so they simply don't touch it.
Yeah.
So I think this has been a very important aspect that enabled the continued perpetration of this crime, is that the courts of law are just simply missing in action. Right?
Yeah, it's really scary. Anyone?
It is. I mean, there's no branch of government, no branch of the administration, of public administration.
Are you familiar with Brooke Jackson versus Pfizer?
Vaguely.
Yeah, well, I
know of her case, but I have not.
Okay, I had the pleasure of interviewing Brooke Jackson, who's going to be back in court, and I hate to be redundant here for those who heard that interview, but the things that were revealed in her case against Pfizer were simply astonishing. And I think as medical freedom warriors, we should sort of put a list of goals together, things that we can do practically, things that we can support. For example, we've had Mary Talley Bowden on this show. She's taken a great initiative. I think we should support her because she's leading the charge to get officials, both candidates and elected officials, to sign on to say no more mRNA products. We don't want those in our society. But in the case of Brooke Jackson, what's so astonishing is she presented a range of alarming things that went on at this so-called trial, like a safety trial for this product, things she had never seen before in 20 years as an auditor. Pfizer denied none of it. They denied none of it. They said, well, we were committing fraud in the manner that we were instructed to do by the Department of Defense.
Yes, exactly. That's the point I was just going to talk about. I'm not sure whether you had a chance to talk to Sasha Latypova.
Not yet. I'm hoping to get her on at some point. She's extremely busy, so fingers crossed she'll be a guest at some point. But I was actually listening to an interview with her just earlier today. She's phenomenal.
Yeah. I mean, she's also extremely well-informed and experienced and extremely bright, so I think you should get her on the show.
Yeah, I hope so. I hope we can get her on at some point, and she's friends with Brooke Jackson as well. And she's the one who highlights the Brooke Jackson case.
Yes, exactly. She makes sense of it. She explains how all this came about and why Pfizer sees no reason for concern because they have been taken out of the firing line. I mean, even the FDA doesn't really have any responsibility. So if Sasha is right, I mean, we are not a legal expert at all, but if Sasha is right, then we have completely irregular legal arrangements to prop up these vaccines.
Right.
I mean, they are not even official.
It's a great way to put it. Irregular legal arrangements. Write that one down, everyone. You can add that to your phrase, your paradigm of essential phrases here. Okay,
so these were apparently not even drugs. They are declared as medical countermeasures, and just simply So these are just simply things that the DoD has taken upon itself to authorize and this sort of thing. So it is completely parallel, completely outside the usual track of approval of medicines.
In my correspondence,
so the FDA, according to Sasha, the FDA is just simply play acting, and Pfizer is simply play acting. Pfizer is play acting clinical trials, and FDA is play acting the review and approval of these products. Neither of them have any responsibility.
Right.
That's what she says.
Right. In my correspondence with Sasha Latypova, she answered my question very thoroughly, which is basically, these are defined as countermeasures, which makes me ask the question, countermeasures against a disease or countermeasures against the public?
Countermeasures, I think yes. That's a good question, but I think it's probably they pretend it's a countermeasure against this biological
Yeah, there's an
weapon.
acronym. There's an acronym. I forget what it is offhand, but against
okay.
toxic
Right.
effects or whatever.
So,
But I want to ask you, Dr. Palmer, because we are getting to the home stretch here, and there's a few more questions I would love to ask you. And one question that I would like to ask you, which I would like to again ask any doctor I get the opportunity to ask, is, one thing I learned as an activist is always listen to the people. Always, keep an ear to the ground, so to speak. Stay in touch with the ideas and the understanding of things that's possessed by the common man and the so-called common woman. And on the streets, these shots are called the D-pop jab. They're called the clot shot.
yes.
As a medical professional, how do you justify your remarks that you've made previously, which indicate that you believe that these vaccines were part of an intentional plan to injure and kill? How do you justify such a radical statement on your part?
Well, we have already covered some of the reasons, right?
Right.
I mean,
right. I guess to add
crime
to what
has
you've
been
already
going
said.
on for a long time now. I mean, the bodies continue piling up, and the injured continue to accumulate. It has been going on for several years now, and there still is no corrective action.
Right,
That's
exactly.
one thing. Another point is that it was really predictable. I predicted
Right.
it. My former boss, Sucher at Bhakti, predicted it. We found out. We both wrote about it independently, and after we reconnected, we actually found out that we had come to the exact same conclusions, based on simply a reasonable understanding of immunology. But neither of us are really pure immunologists.
Right.
So it was nevertheless possible for both of us to figure it out, and arrive at the exact same conclusions. And the people who developed this should have come to the same conclusions also.
Right.
Then, I mean, at every turn, at every fork in the road where there was a choice to make, right, the road was chosen that would lead to the greater damage.
Right.
For example, consider the pregnant women and breastfeeding women. Okay?
How reckless.
They were excluded from the clinical trials. There were some rudimentary, fragmentary animal data that nevertheless would tell the expert that these vaccines will in all likelihood spread to the placenta and to the lactating breast glands.
Right.
Okay? And this has in the meantime been confirmed on humans, right? There are several cases in the VAERS database that report infants, breastfed infants, falling sick or even dying after their mothers had been vaccinated shortly after.
Right.
And the vaccine has been demonstrated in several studies in breast milk. It has also been demonstrated in the placenta by several people independently. It has been found in the fetal circulation and so on, so that's all clear. So there were no safety data, there were no clinical data in the from the clinical trials on these two groups of women. Nevertheless, immediately after those vaccines had been given emergency approval, the vaccines were recommended to these people, and it was said, they were told everything is safe, everything is is above board. I mean, this is clear malpractice. I mean, I'm not sure what the term is here. Malpractice is
malfeasance.
Individual practitioner, but this is just completely irresponsible. And I mean, as
irresponsible at best, right?
Yeah, and I mean, even after a few minutes, right, a few months, after a few months of vaccinations, there were enough cases of myocarditis in the VAERS database to prove beyond reasonable doubt that there was a causal association between the vaccination and these vaccines. Yeah. What did the CDC do? It didn't revoke any approvals or recommendations. It extended recommendations to ever younger children, right? I mean, this is just what do you say to that? I mean, it is just so much evidence. Or, for example, also forcing the vaccine on people with proven natural immunity.
Right.
You have already had COVID. You may even be able to demonstrate antibodies in your blood plasma.
Right.
No matter, you still got to take the vaccine in order to keep your job.
Right, and isn't it correct to say they didn't even attempt to come up with an explanation as to why that was a legitimate policy?
Yes,
Basically, it was just well, because we said so, because we want you to do it.
And I consider what I told you earlier, right? The more immunity you have, the worse the reaction to the vaccines will be. And there are indeed some reports on people who had a catastrophic and quickly lethal reaction to their first injection of vaccine within hours or a few days. Okay, there are some papers which you really can describe only as a whole body disaster. There's one paper on a Japanese man who just simply had total multi-organ failure and total columns of perfusion and this sort of thing all over the place just a few days after receiving his first shot. And this guy had a history of COVID infection. Okay, so these people had already primed immune systems, right? Had they been vaccinated with a traditional vaccine, probably nothing at all would have happened. The antibodies would have simply bounded, and that would have been the end of it. But with these vaccines, because the antibodies cannot stop the vaccine particles will get into the body cells, and then you will have this disastrous reaction. So this was one thing. Then also the suppression of alternatives, right? I mean, we have studies to show that if you simply bring up the vitamin D plasma concentration to optimal levels, this reduces the likelihood of contracting COVID or succumbing to COVID by something like 100 times. So essentially to zero. These treatments were never propagated. I mean, this is simply taking vitamin D is a much more effective preventative measure against COVID than any vaccination.
Right.
But this is not advertised. And it is also, I mean, we understand the risks. Same goes with hydroxychloroquine, goes with ivermectin, right? I mean, ivermectin has been used on billions of doses worldwide. I don't know the exact number, but has been used all over the place. It's one of the WHO's essential medicines, right? The WHO has a list of essential medicines which are used for important diseases. Okay? It's one of the safest drugs known. Now, in the context of COVID, all of a sudden, WHO tries to outlaw and ban the use of
extremely suspicious.
Very safe drug. Same goes for hydroxychloroquine.
Right.
There's a paper from 2005 that shows effectiveness of hydroxychloroquine against SARS, right? Close relative of SARS-CoV-2, the COVID virus. Do you know who is one of the co-authors?
Fauci,
exactly.
Ooh.
Fauci himself is on that paper. So, I mean,
and now you have to take the Fauci ouchie.
so how can you doubt at that point if you see these sorts of shenanigans? I mean, I think the only rational explanation is that this is a deliberate crime.
Seriously.
Simply no other explanation makes sense to me.
Now we're getting really to the home stretch here, and we actually have a caller on the line. I'm hoping to get to the caller, but I would like to ask you this important question. I'm not sure if we're going to get a chance, unfortunately, to discuss the DNA issue, which I did want to address with you, but we might not have time. But I wanted to ask you, I asked Dr. Kat Lindley, and she's actually going to be our guest next week. Everyone, please tune in for my conversation with the outstanding Dr. Kat Lindley. But she was very optimistic, and in our preliminary exchange over email, you were also surprisingly and pleasantly optimistic that it's possible that someone has taken these harmful injections and will not have their harm or not have a harmful outcome from this, that basically they will not have their lives shortened or their health injured in one way or another. Because that's something that sort of fascinates me and I wonder about is how can something that induces so many side effects and harms some people so severely, including just outright death, how could such a thing be injected into somebody and not have a harmful effect at some point? Is it wishful
Right.
thinking to say that that's possible?
No, I think it's quite realistic. I mean, the first thing is.
But could I also ask you, before you launch into it, and I know we're just crunched for time here, but I just want to ask you, that question without, to cautiously tie it into your previous answer, because if there was intentional harm done and then someone could be injected by this and not be harmed, didn't the people who intend to do harm fail then in their actions?
Well, I think that the plan is they were sneaky, right? I think if you inject something that has a very predictable and reproducible effect on everybody, then it will become very quickly obvious. So I think one aspect of these vaccines is that the disease tends to look quite diverse, right? I mean, there are similar cases when in many people they have damage to the nervous system and so on, many cases of myocarditis. But overall, you have a very broad spectrum of disease, right? So it's sort of a chameleon. So that already throws some people off, right? They will not consider that such diverse diseases might all be connected to the same underlying cause. Even so, we actually know similar diseases. These are called chameleons of medicine, at least in Germany they are called that way. These are diseases that originate in the same manner, have the same mechanism of causation, but can manifest in different forms and different organs. For example, lupus erythematosus is one of them, tuberculosis is another one, okay?
Yeah.
So that's one thing. So you can have multiple different forms. So this is one way of being sneaky, and another way of being sneaky is to vary the toxicity of different batches.
Right.
Okay? Now, there is clearly some batch-to-batch variation in the number of reported adverse events. There are some people who claim that this is merely due to a reporting bias, right? So at different times and at different places, the likelihood of an adverse event being reported is different. That probably contributes. At the same time, we already mentioned the DNA contamination. It is very clear that the level of DNA contamination is very different between different batches.
Right.
To what extent such variation also exists with other ingredients, for example, the RNA, it's not clear. But then you also have maybe unintentional variation of toxicity, and that is because these vaccines are not quite stable. Right? Initially, it was told to everybody that these vaccines need to be deep frozen for the entire time,
right,
until briefly before they are being dispensed.
Right.
Okay. Now the facilities for to guarantee this continued deep freeze, the cooling chain, it's not in place everywhere, right? I mean, the doctor's office around the corner might not have a chest freezer, right? So
yeah, I mean, it struck me as counter-evolutionary. Like, why would the human race be designed to be something that would be exterminated if we didn't have some exotic subthermal thing inserted into us? Like, it's counter-evolutionary in my mind, not that I'm an evolutionary biologist. But I'm sorry to cut you off, Dr. Palmer, but I would like to hear from our caller. We do have a caller on the line.
Right.
And Tali from Brooklyn, I believe, is on the line. If you could please ask the question in a manner so that we leave a little bit of time for Dr. Palmer, to respond in the last minute of our program. But welcome, Tali. Are you on the line? Can you hear me?
Yes, I'm still here. I had a few items I wanted to touch base, but I'll save some for next week. But I do want to commend you on this particular presenter. Usually you listen to radio and television, and the person takes the time, the presenter takes the time telling you what they're not saying.
Right.
Okay, they're in complete denial. I'm not really saying this, so why? Don't say it, get over it,
Right.
But he was very adamant about his particular information, and he stood by it, and he was not, what shall I say, afraid to, quote unquote, name names and give numbers. And I appreciated that because I agree with everything that he said.
I agree.
Okay, so compliments to him for being honest. Everyone's afraid to be honest, like they're going to live forever.
Right.
Okay? You know that the forces that be at the moment are very treacherous and whatnot, but by the same token, there is a creator. So truth is the light, and you got to let it shine. So the second point, the rest I'll leave to next week, is that you asked a question about the nefariousness of it. I mean, like, if you take poison and it's poison outside the body, what do you think it's going to be when you put it inside? Spike protein is poisonous outside the body. So are the other things that name. You don't even have to mix them. They are inherently poisonous and dangerous and deadly. So you don't accidentally put poison in food, drink, vaccines. And that's the last thing I will say. We must at some point stop calling them vaccines, because at some point the truth has to come out. They're not vaccines. Call them for what they are. They are bioweapons. Call them bioweapons. Why are we still calling them vaccines, giving validity to a vaccine? That's not what they are.
Yeah.
The rest will hold to next week. But
well, thank you. Thank you for those comments. And yeah, a doctor on a Twitter space, I don't want to say her name incorrectly because it was someone I wasn't familiar with yet, but who was very fascinating, used the term, we have to clean up our language in regard to that kind of stuff. So I agree with you. I call them products that were falsely marketed as vaccines, or I just call them fake vaccines, or I'll just call it like they call it on the streets, the Depop jab, as harsh as that is.
Yeah, they're just poisons.
Thank you so much, Dr. Michael Palmer. You are truly outstanding. I thank you for your insight and for your courage. Doctors for, that's the number 4, covidethics.org. Doctors for covidethics.org. He's a contributor there, and there you can find his outstanding book, which you can download, mRNA Vaccine Toxicity. So if they say, oh, these are safe, well, take that to your doctor and say, why would you offer me a toxic product? We need to start confronting doctors at this point, for sure. Tonight we're going to have this Twitter space with my good friend Ariel and journalist Brooke Hines, and Destiny is going to be on board. So great researcher who's done a lot of great work who I hope to have on the show at some point. But please look me up on Twitter. Earth Driver is my handle, Earth Driver. We're out of time, everybody. Thank you, Dr. Palmer. You're outstanding.
Thank you. Thank you very much.
Have a great rest of your day. Have a great weekend, and keep fighting the good fight. Thank you, everyone.
Great. You too. Thank you very much. Bye-bye.